Hello, this is my assessment of Tina Jones. I have already introduced myself to her and told her that we'll be doing a health assessment on her today. Here is my ID. You can see it very well, but that's who I am. R.Valella. Okay, let's start the assessment. Vitals are good. Blood pressure 128/82, heart rate 78, respiration's 15, temp is 37.2, oxygen is 99% on room air. What is your name and date of birth?
My name is Tina Jones, and I was born on February 17th.
What building are you in right now?
I'm at the doctor's office. It's Shadow Health General Clinic.
What is the date and year? What is the date and the year?
Today's date is
Very good. Thank you very much.
Thanks.
Let's start by inspecting the head. Scalp is clear, no dandruff, no bugs, no sores on her scalp. Hair is clean. Let's turn this on. Ooh. Pupils are equal and reactive. About 2 centimeters. Very good. Let's inspect your mouth. No sores. Any sores in your mouth? Trouble swallowing?
Nothing's been wrong with my mouth.
Good. Tongue looks healthy. Very good, very good.
Oh,
check your gag. Sorry about that gag reflex.
thanks.
Alright, chest is good, symmetric, no protrusions. Same thing with the cardiac chest assessment. I suppose I didn't have to redo that. Let's palpate those carotids. Any pain? No? Carotid +2, no thrill. Right carotid +2, no thrill. Let's auscultate that heart. I'm going to listen to your heart and lungs now.
Thanks for telling me.
S1, S2 in aorta. S1, S2 in pulmonic area. S1, S2 at Erb's point. S1, S2 at tricuspid area. S1, S2. In all points. You know what? She sounds pretty darn good, don't you? Mitral valve, S1, S2. Let's listen to your anterior chest here. We're going to listen to your lungs.
Thanks.
Lung sounds clear anterior. No wheezes, crackles. Posterior chest. Symmetric. Skin is clear. Take some nice, easy breaths.
Thanks for telling me.
You're welcome. Clear right posterior chest wall. Clear left posterior chest wall. Clear middle right posterior chest wall. Clear left posterior chest wall. Lower left posterior chest wall clear. Right lower posterior chest wall clear. Right lower posterior chest wall clear. Left posterior chest wall clear. I'm going to listen to your abdomen and palpate your tummy a little bit.
Thanks for telling me.
You're welcome. Light pressure, soft, no masses, left upper quad. Right upper quad, soft, no masses. Left lower quad, soft, no masses. Right lower quad, soft, no masses. There it is. Left upper quad, normal. Bowel sounds normal. Right upper quadrant, normal active. Right lower quad. Absent. Oh. Right lower quad, normal. Right lower quad, active, no more active. Okay, listen to your abdominal arteries. Aorta, no bruit. Left renal artery, no bruit. Right renal artery, no bruit. Left iliac artery, no bruit. Right iliac artery, no bruit. Right femoral artery, no bruit. Left femoral artery, no bruit. Very good. Let's go back. Alright, upper extremities. Cap refill good. Less than 1 second. Bilateral. Let's check the pulses. We're only checking the left radial. +2 bilaterally. Lower extremities. Let's check those feet. Come on. Let's check those pulses. Cap refill. Less than 1 second. Cap refill. 1001. Less than 2 seconds. Check those pulses. Left pedal pulse 2+. Right pedal pulse 2+. Right tibial pulse 2+. Left tibial pulse 2+. Skin looks good. Patient has no sores. Clear. Some redness around the neck. Skin discoloration. We are all done, Miss Jones.
Thanks for telling me.
And that is the end of my exam. It's a basic exam that I would do on any of my patients in the hospital. I thank you for the opportunity to learn using the shadow health method. I really enjoyed it. Thank you very much.